Welcome to the Beverly Hills Plastic Surgery Podcast. I'm Dr. Millicent Rovelo, and I'm here with my most feminist-supporting co-host, Dr. J. Calvert. How are you?
That is correct. I am ready for this podcast. And by the way, I am glad we're talking about it because it's something that I think just needs more discussion.
Oh my gosh, it needs so much more discussion. So let me just put it out there straight. What we are talking about today is anti-aging and rejuvenation of the female genitalia, the lady bits, the lady parts, the fun house down below, like all of that stuff that doesn't get talked about. And, even us plastic surgeons, this is what we do. We have spent so many podcasts talking about how to rejuvenate your face and how to rejuvenate your neck and the anti-aging of your hands and your breasts. And we have left out what happens down below. And this is a common trend and theme amongst our society. We don't talk about what happens to women after pregnancy, after childbirth, as they age. It's like a black box. Pun intended.
But it's true, and it's really important because I think just because there's lack of knowledge, people don't bring it up. They don't come in to talk about it. They don't want to. They just don't even know where to begin with it. And some internet searches can make you very confused. I will tell you that much because the information comes at you in a disorganized fashion. So today we are going to kind of maybe just start from top to bottom and really talk about how to rejuvenate the vulva, how to rejuvenate the mons pubis, how to rejuvenate the vagina, all these how to understand urinary incontinence that comes after pregnancy, these things that what to do with the labia minora, with the labia majora. And I'm just going through sort of the basics of what comes up in consultations.
Right. And a lot of times, too, is that people just don't even know that there are options. Like it's just, oh, this is just what happens and I have to live with it. I have one patient in particular that was like, she was literally livid. She was like, why didn't my mom tell me about this? We go through all these books about puberty and what to happen when you get your period and this like becoming a woman thing. And none of our mothers or society in general sits down and tells you what happens at the other end when you're hitting menopause. We're like, why am I just finding out about this now as I'm going through it? So yes, this is where we're going to sit down and talk about all things that happen with time and age and gravity and childbirth. And so I think let's just start at the beginning. So at a younger age, things that can happen. So like why would you need any of these services, which we will get to? Number one, pregnancy and childbirth. So even after 1 child, 2 child, 3 child, you lose strength of the pelvic floor muscles. And it's not uncommon to have urinary incontinence after having babies. And so this can be, when you laugh, when you sneeze, when you jump on a trampoline, anything that sort of causes increased pressure in that area, the weak pelvic floor muscles can lead to a little bit of urinary incontinence. So that can happen at any age after pregnancy. And then as you get older, you start getting into what you see as the aging genitalia. And the same way that you lose volume in your face or you start to get loss of skin elasticity in your face and neck, same thing happens down here. So this is where you see loss of volume of the labia majora. So these are the outer lips, which in youth are normally more plump and full. And over time, they lose volume and the skin gets less elastic and they can sag. And it can actually be functional too. I have had women be like, it actually hurts to sit down because they've lost that padding really. And then
that's for sure. I mean, that volume issue, and that's where I found that a lot of fat grafting gets talked about. Whereas with the minora, which it sounds like you were about to hit next.
I was about to get to.
So why don't you hit that?
Yeah, I'm just talking about the problems, and we'll go through the solutions for them. But the next one is the labia minora, which are the inner lips. And some people, even at a very young age, will just have either an asymmetry or particularly long labia minora. There is no normal length of a minora, and you can reference back to our actual labiaplasty podcast about that. But over time, with pregnancy and age, the labia minora can grow as the labia majora kind of shrink. So it gets to be this disproportionate length between the two. And you may see a more protruding labia minora than you may have had previously when you were younger. So that's a labia minora. Then you start going internally into the actual vagina itself with, menopause, changes in estrogen, changes in hormone. There can be a whole lot of issues happening here. And it can be loss of libido, loss of stimulation, inability to achieve orgasm, which can actually be at any age. Loss of lubrication, so things are just drier. It's harder to have sexual intercourse. Things just don't function as they used to. So that's sort of the genitalia area. And then as you mentioned as well, if you go a little further north, that's going to be the mons pubis. That's the area of skin and fat over the pubic bone area.
You skipped an area.
Well, the clitoris, yes.
Sometimes people just skip over the clitoris. They need to do that. It's an important area because the clitoral hood is also an area that gets attention surgically because of its issues.
Right. So in this kind of the same way that the labia minora can be excess skin, you can get excess skin over the clitoral hood as well. And then, yes, going a little farther north.
Now you can go to the mons.
Now we can go to the pubic area. This area can get fatty. It can lose some elasticity. It can hang over time. So it just contributes to sort of the aging look of that area.
Can I also make a quick point about the mons pubis and C-section scars?
Oh, yes.
Because I think this is a big issue for a lot of women. C-sections are really common now with childbirth. Mm-hmm. I think at Cedars-Sinai it's 50%, maybe higher. So you're talking about this, we have a term for it to make it shorter called the FUPA.
The FUPA, look it up.
You can look it up. It's definitely an urban dictionary kind of thing. But that area gets sort of puffy and it bulges out, which is most women are not looking to have a bulge in their pants.
Looking for it, yeah.
Right. But the problem is I think that it's kind of like a lymphedema situation. I think that because the skin has scarred down, the soft tissue is scarred down to the underlying fascia.
Where that scar is.
Yeah, it gets where that C-section scar is, which is typically above the pubic hairline or above the mons pubis. It gets scarred down, and then you just don't get good lymphatic flow out of that area. So I think there is a component of kind of a drainage issue after a C-section scar where it just, it needs to be revised, obviously. But let's keep going. You're doing great.
No, that was it. That was the definition of why we have issues here and when they can happen and why they happen. And so then I sort of wanted to go through the options that we have for treating them, and that can be medical treatment options, which I'm not going to get too much into because that's not my area of expertise.
We're surgeons.
And then I can get into like the mechanical treatments that we have. So the medical treatments, this is where you're going to go see your gynecologist or your functional medicine doctor. They're going to do a whole host of hormone panels and see where you're deficient. Maybe it's an estrogen, testosterone, and I won't even try to speak on how that would work. But that is a place to start. If you're sensing some changes over time as you're hitting menopause or perimenopause, go get the hormone levels checked, and they can either give you extra hormones to take by mouth. You can do patches, estrogen cream in this area. There are estrogen rings that you can insert that, supply estrogen to the area. So that's one area that I think I will leave to those experts, but is definitely a huge, huge component of the perimenopause, menopause treatment.
Yeah, I think those, the concept of getting to the, absolute hormonal imbalances that are occurring is extremely helpful in terms of some functional issues that women can really experience early. You don't have to be 75 years old for these to be problems. This can happen in your 30s and 40s, and 50s for sure. And so you want to be aware that there are treatments for sure. And in terms of functional issues, which I think it sounds like you want to go to next about like the labia majora, minora, we can certainly talk about those issues in the context of surgical treatment. So do your medicine, make sure that your hormone panels are where your doctor wants them to be. But then you may still have some issues which could be functional in nature, but also could just be totally aesthetic as well. You just don't like what's happening.
And so I think let's start, as you mentioned, top to bottom. So we talked about the mons pubis. This may be after a C-section. You have sort of that sort of indentation and fullness of the mons pubis. Or it could just be after normal aging, some weight gain, some pregnancy, some skin. I mean,
it can droop.
Everything falls when you age.
It's droopy.
Gravity is a powerful force,
and it's
and it sags. So
it's not cute. We want to make that better.
We want to make
we
that
can help
better.
that.
Now that's typically treated. If you're doing a formal tummy tuck, this area is going to be treated.
For sure.
If you're going to remove extra skin from up top, I would say most plastic surgeons address the mons pubis. You get a suprapubic lift with your tummy tuck. That's sort of part and parcel of how it happens. But say you don't need a tummy tuck or you don't want a tummy tuck, you just want to address the mons pubis, that's called a suprapubic lift. And it can be combined plus minus with some liposuction of the area. But really the mainstay of this surgery is to pull up and remove any extra skin that may be there, but really just to pull up that area and fasten it into a higher position to tighten and really smooth out that mons pubis area, plus minus any revision that has to be done of a C-section scar.
Yeah, I think the liposuction component's really important. And you can do just liposuction for the mons. But remember, when you take the fat out, the skin can sag. So it's usually a combo therapy where you're doing some sort of skin excision and then also doing the liposuction with it.
Yeah, I don't do as much liposuction. I kind of just like to directly excise the fat. So once I've lifted the skin up, I can see exactly where the excess is, and I just cut it out directly.
Yep.
Liposuction, either one's fine. I just find with liposuction, it tends to stay swollen a little bit longer and have a little bit more problem with the lymphatic drainage issue.
Yep.
So if I'm looking right at it, I already have it open. I just like to cut it out directly. Either one works fine. But that is sort of the treatment for the pubic area. And then as you continue to go farther south, now we're looking at the external genitalia at the labia majora itself. And so this is the area we talked about that can get deflated over time. So it actually loses volume and the skin gets loose and stretchy. So mainstay of this is fat grafting. So as you mentioned, you don't need a lot of fat, a little bit of liposuction, and then injecting that fat directly into the labia majora works really well to sort of pad it up and get the volume back there. In not rare, but in very few cases, you may actually need to cut out skin if it's a lot of excess skin, but a lot of times just the fat grafting alone will plump it up enough that you don't need to remove any skin. But this is an area that you can do external skin tightening treatments. So
Correct.
Similar to how we do a Morpheus treatment on the face, there are Morpheus treatments for the labia genital area. So that radio frequency technology that goes sort of deep underneath the surface of the skin can be applied and the same way that we do it on the face. And it helps to tighten and create collagen over time in this area.
Yeah, I mean, I think you need to have, like anything in plastic surgery, it really comes down to making a good diagnosis of what the problems are, really assessing what the issues are. Is there volume loss? Is there too much skin? Is it a combination of those things? And really assessing what the issues are. And, of course, the most important thing, what is the patient looking to achieve with their surgery? Because everybody's got a different idea of what they want.
Different.
And this is by the way, it's a very specific set of desires that, the patients will come with. They'll say, well, what I want is it to look this way. They want to have a certain look. They want to have a certain size, and the way that the entire vulva looks is important to them. And it is, obviously there's a lot going on. There's labia majora, the menorah, and the clitoral hood, which all kind of have to work together to look the way that the patient is looking to have it be.
The patient wants it to look. And one appearance might really bother one patient, and another patient's totally fine with how that looks. So it is very patient-driven about what they are looking to achieve. And then the other piece of the labia is the labia minora, as we mentioned earlier, either from just normal genetics or over time, hormone changes. That labia minora can get elongated. So that's where a traditional labiaplasty is performed. Again, go back to that podcast, but that is a procedure that is designed to remove redundant skin of the labia minora Ideally, typically, if someone's coming for that surgery, it's because they want the labia minora to be sort of tucked in, kind of hidden beneath the labia majora. They don't want to see the extra skin protruding. Although I have had some patients sort of like, I don't really care what it looks like. It's just, it's excess, it's in the way, it hurts with sex. Like, just make it better somehow. And they're not really coming for a specific look. But usually you trim it enough that it sort of is tucked in and hidden between the folds of the labia majora.
Yeah, and that operation, by the way, is not, it's not simple. I think, people think, oh, you just like snip off the extra labia minora.
Nope.
It doesn't work that way.
No, it doesn't.
I typically put a little Z, a Z-plasty to break up the scar. And in terms of how to do that, I mean, again, there's a functional aspect here you must be cognizant of. You cannot over-reduce the labia minora. You want to be very careful. And I remember this one patient came to me, and she was a nurse, and she said, "I need you to help me with something." And she was kind of like, "I know this is like you don't have this on your website, and like I don't know how much you do of this, but I think I need you to do this operation for me." And I was like, "Okay." And she said, "You do labiaplasty?" I was like, "Yeah, I do a lot of labiaplasty, but it's not something that we have huge websites about because you really can't. It actually dings your website by the Google bot. So, you can't put before and afters on Instagram. That doesn't work. Yeah. But at the same time, I would say probably 1 out of 10 of my abdominoplasties talk to me about labiaplasty, which we do at the same time that we're doing the tummy tuck. Sure. And so doing the vaginal rejuvenation procedures and vulva rejuvenation procedures are pretty common in that setting. So she came and said, I really have so much pain with intercourse, and it's because I have these long labia, and I need you to reduce them. And I was like, sure, I'm happy to do that for you. And that was the driver. It wasn't even the look. Like right. She didn't care. I said, any requests on the look or whatever. Yeah. She said, no, just I need them to be smaller so that I don't have so much pain every time I have intercourse with my boyfriend. I said, I get it. And so after we did it, she was beyond relieved and, basically told her friends. And so it started this steady supply of labiaplasties on nurses. So,
labiaplasty expert right here.
Not an expert. I don't claim to be. I know how to do the operation. I know to put a Z-plasty in the labia minora to prevent that scar from contracting, because that's the problem over time. So there is some technical, prowess that you need to have to do a really nice labiaplasty, and I can think of some patients where I did reduce the labia majora as well because they just kind of wanted everything smaller and cuter, I guess. But it just was these operations do come in all shapes and sizes, and typically the clitoral hood is also addressed at the same time.
Clitoral hood is, and not everybody needs this, but it's not uncommon if you have redundant skin of the labia minora to also have some redundant skin of the clitoral hood. And this is really just an extension of the labia minora that covers the clitoral hood. And it can be fairly excessive to the extent that it covers it completely. Sometimes, in some people, it barely covers it. There's all versions of, quote, normal. But if you are reducing the labia minora and there is excess skin of the clitoral hood, usually it's combined just so that there's some harmony in how things look. So there's not over excess of skin in one area and less skin in another. So the idea is to create a harmonious flow of aesthetics, although sometimes the excess clitoral hood can be symptomatic as well. But usually, we're doing it just to make sure everything still looks good and harmonious down there.
Yeah, I mean, the external aspects, the vulva, it needs to be like it all kind of works together. Yeah. That's how it looks nice. And I can tell you that I've had, a lot of the patients will come in and they kind of bring their own mirror. They're like, let me show you what I'm looking for. Can you do this for me? And they're very, very specific about what they want. And that's great, because the more specific, the easier it is to kind of hit the nail on the head for them. And it is important to kind of have that communication with your patient.
Yeah, absolutely. And so that's sort of the external appearance, which does have a functional component to it, as we mentioned. But then there is the actual functional components of the vagina. And so this can range the gamut. So you can have young patients that maybe have problems with lubrication, or they have decreased sexual libido or an inability to achieve an orgasm with intercourse. or they're young, but they've had kids and they have problems with the urinary incontinence. Or you can have patients that are just older and having these same problems of dryness, decreased libido, decreased problems achieving orgasm. This is where things like the OSHA, which I'll talk about, comes into play. There's also internal energy devices. There's like the FemiLift, there's the Mona Lisa. These are, if you think about sort of like a tampon being inserted through the vagina, applying energy to the internal aspect of the vagina. These are other options that can help with a lot of these issues. So that's where the internal treatment can come from.
Yeah, the FemiLift is great. It's a CO2 laser, and I am a luminary for all my lasers, so I do need to mention that. But we have the FemiLift at Rock Spa, and they like
great.
it.
It's great.
This is a popular treatment.
This is a popular one. And it's something, you come in, it takes about, 5-10 minutes to perform, and you do it 3 times, maybe, update it once every year or 2.
Yep.
And that's pretty much it. And so there's the FemiLift and the Mona Lisa. They're very similar treatments. They use a little bit different technology for both of them. But those are sort of the brand names of the two of them, similar treatments. And so the idea is if you do the internal treatment, that it improves dryness, it improves libido, and it provides some tightening as well. So after kids and with age, some tightening. There are ways that you can also, if you change the heads of it, do similar treatments to the outer genitalia as well to get similar energy. But they all sort of do the same thing. They create micro injuries that then increase collagen and blood supply to the area, which then goes on to improve a lot of these issues.
Yeah, the FemiLift is popular, not only with the mommies, but also with the daddies.
But also with the daddies. It's like it's a crowd favorite.
It is. It works, and we've had it for a long time, and it's been really effective. And the patients send their friends. That's how I know that they like it, because they get the results they want. They tell us about it, and then when they refer their friends for these treatments, you know that it's a good thing.
It's working. Yeah, I had a patient tell me once. I think she was finishing up with her 3-package session of the FemiLift. She's like, yeah, my husband doesn't know I'm doing this, but he did comment the other night. He was like, are you on your period or something? You just seem like more swollen and kind of full down there. She was like, no.
Yeah, totally.
It can be noticeable.
Orla's been doing those for us. She's our PA in Beverly Hills, and she's always been happy that the patients really get a lot of satisfaction out of that per treatment.
Which brings us to the O shot, the orgasm shot, as it's sort of colloquially known. And what this is, so this is when you take a blood draw from yourself and you remove some blood, and then you spin it down with a centrifuge and you remove what's called PRP, platelet-rich plasma. And this is the same thing that's done, as we all know it, as a vampire facial. So you take the PRP, you put it on your face, and you do some microneedling. Well, that same PRP, the reason we love it so much is because it comes with growth factors. So when you put it anywhere on the skin, it's going to stimulate the tissue in that area to improve its blood supply, to improve the collagen. So that's why when you inject it, it can do the similar things that these energy devices can do. Improve libido, improve blood supply, tighten, improve lubrication, because it really is a rejuvenation procedure. You're bringing in all these things that you may have lost over time with the growth factors. And so the O shot is something that can be injected into the vagina itself. It can be injected around the clitoris. It can be injected into the actual labia themselves. All of these areas will improve with these growth factors. And again, typically a series of about 3 injections. Results last anywhere from 12 to 18 months, and you come back and you have another repeat injection, every year or so.
Yeah, and the O shot is, it's placed basically into the area that would be the G spot.
The G spot, that anterior vaginal wall.
Yeah, it's
anterior, so like the front of the vagina. It's the G spot, people. Look it up.
It's a kind of a difficult spot to get to, but it's doable.
As many people would attest.
I don't know what you're talking about. But the reality is that it does work, and people are happy with it. And that's been these things. You know that they work because they've been around a long time. They would disappear if it wasn't working. If it didn't work, they wouldn't do it.
For decades, and people come back for more.
They do. So that's a nice thing to do if you want to get, for trying to have, more robust or achieve orgasm, then an O shot is something to consider for sure.
Absolutely. And all of these things work together in harmony. Like I have one patient, God bless her. She literally has a team of people that work on her perimenopausal changes of the genital area. She has her menopause gynecologist. She has me to do some fillers and some other things that I do for her. And then we're talking about surgery maybe down the line. She has another person that does her O shot and her Morpheus treatments. And she was like, I am not going down without a fight.
That is the right attitude.
Yeah, and she has it. She has like a calendar, and she's like, I get my O shot this time, then I do my Morpheus this time, and then you do my filler here. And so like she has a calendar the same way that people address their face. I'm getting my microneedling every 3 months. Then I'm going to have my photopixel every 6 months, and then I'm going to do a Morpheus. Like the same way you map out an anti-aging treatment for your face and your neck, you can do the same thing down below.
100%. It's all about how much time are you willing to dedicate to the problem that you want to solve. Yep. And if you're willing to dedicate the time and I guess the money and the effort, then you're going to get the results. So it is, and I'm glad that we're talking about this because I think a lot of people will look more into it now that they can hear the terminology, they can understand that there are treatments and that they don't have to just kind of go it alone. It is really there's a lot that you can do.
There's a lot that you can do. There's so much information out there. So just start talking to your gynecologist, start talking to your friendly neighborhood plastic surgeon, your dermatologist. Like just look and see what's out there because there are many options for any particular issue you may be having.
Yeah, and I know that the operation. I have so many before and afters, but I don't even know how you even display those because we're so censored now by the internet and by Instagram and by all these. There was a time that my website completely disappeared from the internet because of before and after photos, and they were medical before and after photos, and they were just breast augmentations. And so your website can really take a beating if they think that it has anything to do with pornography. Yeah, what happened with my breast augmentations? We had to call Google because my website was like gone from the search engines. And so I got a hold of somebody at Google, believe it or not. This was a lot of years ago. This was in 2011. I said, hey, I launched my new website. It disappeared. What happened, you guys? And it took a few days, but the short version of the story is the Google robot thought it was pornography. And I said, what are you talking about? He goes, well, most of the breast augmentations on the internet, the breasts are so far apart. Yours are really close together, and there's a lot of cleavage. So the robot thought it was pornographic. But they're medical before and afters. They're like, well, we didn't program it to know that. We programmed it based on basically how hot the breasts are on the website. I was like, yeah. He says most of the medical websites don't look so good. Yours look amazing. I was like. So the Google robot gave me 5 stars and banned my site, basically. They're like, that's exactly what happened. So they reinstated it, and they actually made changes to their programming because they were like, yeah, that shouldn't really happen. So they kind of realized they had to make some adjustments. But it was hilarious. I mean, it literally was like 3 days of phone calls to figure out where my website went.
That probably wouldn't happen today.
No,
I mean,
not today.
Look at your Instagram feed. Like, girls are like practically naked and twerking on it.
Right, but if you do it on a plastic surgery site, you get shadow banned, and your account's gone, which is like pretty much every plastic surgeon's. Which is why Instagram's become sort of like, it's good to have it, but nobody's ever really going to see it. It's not a marketing tool. It's something that people can use as reference. Yeah, I mean, pretty much every plastic surgeon that I know in Beverly Hills has been shadow banned, basically, because of their before and after photos, which are medical before and after photos. But you're right. If you have a light shining behind you with a see-through nightgown, you're all good. That's going to get pushed to the top. Like that goes straight to the top. Yeah, so plastic surgeons, beware. You don't want to be shadow banned.
Nope. But, that was a digression.
So anyway, that's why there are before and afters. If you want to see them, we'll have them in the office. We're happy to show you. But I think really the important thing is have the conversation.
Yes.
Understand what it is you want to achieve. be able to, kind of communicate what it is that you want to your surgeon, and you're going to get some great results.
Yeah. Talk to your friends. Tell your daughters what to expect. Get the word out there.
Excellent. Do you have anything else?
No, I think that's it. And this is the Beverly Hills Plastic Surgery Podcast coming to you from the 90210.